Clinical trials show massage works really well for fibromyalgia, but you'll need a lot of massages. That's not going to be a problem for you because I'm going to show you practical home therapies that are easy to use, very effective, and of course won't cost you much. Now, the way I'll do this is to run over why massage works so well on the basic principles, then show you the effective techniques you can use at home. And the video will be just the facts you need. All the other stuff like the details and references will be linked in the description. As I said, if done properly, massage is very effective. I found 10 clinical trials where massage was used to treat fibromyalgia. They covered the spectrum of techniques you'd expect from a professional therapist, including both rubbing techniques and pressure techniques such as trigger point therapy, acupuncture and shiatsu. Now, all but one of the trials had excellent results. Now, the one that didn't basically used the wrong massage. And of course the right massage is very important, so I'll definitely be sharing with you which works the best and which to avoid. Now, the reason massage is so effective is that muscular pain is usually a big part of fibromyalgia, and massage is one of the best treatments for muscular pain. The first reason that muscular pain is so important is that because it can actually cause fibromyalgia. As I discussed in an article linked in the description, although doctors will tell you that the cause of fibromyalgia is unknown, scientists have found that it's actually a sensitization of the nervous system, and the main way your nervous system becomes sensitized is by being bombarded by pain or other stresses over a long period of time. Now, that stress or pain can be from any number of sources, but scientists have found that the most common one is those tender lumps in your muscles massage therapists love to find. They're called trigger points. The best part is scientists found that when they stopped the pain from those trigger points, the symptoms of fibromyalgia went away. Now, it's really simple. If you take away what's causing your nervous system to be sensitized, it'll readjust itself and settle down. Now, at the risk of getting sidetracked, the drug companies don't want doctors to know this. They're making too much money selling you the story that there's no cause and all you can do is to take symptom relieving drugs. The second way muscular pain is a big part of fibromyalgia is that fibromyalgia sufferers usually have fibromyalgia pain and muscle pain, and they add together. If you take away the muscle pain, that reduces the total amount of pain. At this point I have to put things into context for you by sharing you how fibromyalgia usually develops in the first place. As I said, the main cause of fibromyalgia is your nervous system being bombarded by muscular pain from trigger points over a long period of time. People have back pain, neck pain, shoulder pain, or some other forms of pain that involves muscles and trigger points, and the reason they bombard your nervous system over a long period of time is that they're either not diagnosed properly or they're inadequately treated. There's two main reasons for this. The first is that medical doctors too often don't diagnose trigger points and instead just prescribe pain relieving drugs and ineffective therapies. The second is that when muscular problems are diagnosed, most of the courses of treatments just relieve the symptoms without fixing the underlying problem. Now, you feel better, but the pain eventually returns. That said, let's see what you can do about it. Now, please keep in mind that I can't give specific advice to people who haven't examined, so consider this as general information to be discussed with your healthcare professional. Now, the way I'll do this is to look at the basic strategies for massage care, then look at specific massages you can use. Now, the best strategy for fibromyalgia is to avoid getting it in the first place. Now, what the scientists found was very clear. If you want to get fibromyalgia, the best thing it can do is have something like back, neck or shoulder pain and trot down the GP and get some drugs or some therapy that makes you feel a bit better for a while but doesn't get rid of the problem. Now, that way you'll continue to have pain bombarding your nervous system for years and decades, and it'll eventually get sensitized. Now, if you don't want to do that, there's a lot of info on our website about how to treat these problems properly, especially dealing with trigger points so you actually get rid of them. The next strategy is, if you have fibromyalgia, you'll be extra sensitive, so you'll need to start any massage or trigger point therapy conservatively. Now, start off with massage or trigger point therapy that's not painful, and then gradually increase the intensity as you improve and become less sensitive. And if you remember, I said there was one trial of massage or fibromyalgia that didn't work. That was because instead of following this strategy, they used friction massage, which is very aggressive and painful. The next strategy is you'll need a lot of massages over time and just expect gradual improvement. Now, giving it to you straight, you can go see the best massage therapist in the world, and if you only go 2, 3 or even 10 times, you're not going to fix the problem. Most of the clinical trials used 10 to 20 sessions and still only gave incomplete relief. And when they stopped the treatment, the pain gradually came back. Now, as I discuss in my article on why trigger point pain keeps coming back, when treating most musculoskeletal conditions, once the pain's gone, you're only about 1/3 of the way there. This is why you'll need to be able to do some effective therapy at home so you can get the care you need without it being horrendously expensive. Now, the last strategy is that long-standing musculoskeletal issues are usually part of more complex musculoskeletal problems, and the sensitization of your nervous system can cause a host of other complications, so you'll need a bit of help and guidance. Now, you're best to consult a university qualified professional who deals with musculoskeletal problems. Now, the way it can work is that they diagnose your problem, work out what you need and do the technical stuff, and at the same time they advise you on your home treatment. That way you're getting the top professional care, but saving a lot of money by doing a lot of the simple therapy yourself. Now, here's the part you've probably been waiting for, where I show you how to do some home massage and trigger point therapies. Now, first thing I need to show you is how to examine your muscles so you can find what to massage. Then we'll look at the 2 basic types of massage you can use. Now, examining your muscles is easy. You start off by using the flat of your fingers, systematically examine the muscles for areas that feel tight or tender. Now, if you find an area that is, you can use 1 or 2 fingers to examine a bit deeper. Now, what you're looking for is tight bands of muscle and tender lumps. Now, if you find a tight band of muscle with a lump, and pressing on that lump causes pain, that's probably a trigger point. Now, for your massages, you've got 2 types, manual techniques and vibration techniques. And manual techniques are based on the techniques you expect from a professional massage therapist. And with these, you've got stroking techniques and pressure techniques. Now, I'll demonstrate the stroking technique on my forearm because it's very easy to see. Now, what you do is lubricate the skin. Now, it doesn't have to be special oil, just slippery. Then you apply pressure and move slowly along the muscle. Think of it as squeezing out an old sponge, which is basically what you're doing, squeezing out the accumulated waste and allowing your muscle to flush with fresh blood. Now, when you do this, there's 4 important things to remember. The first is that your veins and lymphatic vessels have one-way valves, so you do this going towards your heart, not forcing the fluids through the wrong way through the one-way valves. Now, the second is you work a systematic pattern so you cover your whole muscle. Now, the third, start light and work gradually deeper. And finally, if you come to a tight spot or trigger point, stop for 5 or 10 seconds before gradually moving on. That adds some of the benefits of the pressure techniques I'll discuss next. Now, you'll find this technique to be very effective, and it's very easy to adjust the pressure to suit your sensitivity. The only drawback is that you can only use it where you can easily reach. Now, for other areas, some people try and do the same thing with balls and rollers. Don't. They're not that effective, and even people without fibromyalgia end up hurting themselves. Now, the next manual techniques are pressure techniques. That's like where a therapist will apply pressure while the spot gradually fades and relaxes. Now, you can do this with balls and rollers, but with these it can be hard to control the amount of pressure and very easy to apply too much. Again, people without fibromyalgia hurt themselves with these, so there's no way I'd recommend them for fibromyalgia sufferers who are a lot more sensitive. Now, the pressure technique I do recommend is taken from traditional Thai home massage, and that was found in a clinical trial to be very safe and gave excellent results. Now you can see a picture of the lady doing it here. There's two important things to note. The first is that where pressure techniques often use quite firm and even painful pressure held for maybe 30 to 90 seconds, this technique uses only moderate pressure applied for 10 seconds but then repeated 5 times. The second is, if you're applying pressure with a ball or roller, it can be hard to control and easy to use too much pressure. But with the tool she's using, it's very easy to control the pressure. So to do this technique is very easy. There are plenty of contraptions like this you can get. Alternatively, there are a lot of muscles in your body where that you can use simple finger or thumb pressure. Now what you do is move along, applying a bit of pressure, and when you find a spot that's tight or tender, apply moderate pressure for 10 seconds and then release. Now you repeat that 5 times and then move on to the next spot. Now this can be a bit time consuming, so maybe you have this sitting next to your favourite lounge chair while you're watching TV. The next technique I'll discuss is using vibration massage. Now you need a proper machine, but it's by far the easiest, safest and most effective. For those not familiar with vibration massage, you simply place the vibrating head and the vibrations penetrate, having a host of therapeutic effects like relaxing muscles, increasing blood flow. Now I've got specific instructions elsewhere linked in the description, but here are the basics. All you do is find a spot or trigger point, sit the head on and count to 30. Now you don't need to rub and you don't need to push. These things do all the work for you. And if you've got one with a decent handle, you can easily reach and apply it to anywhere on your body. To help you use it on the different muscles in your body, I'll link in the description to a series of articles that show you how to do self-massage and trigger point therapy for a lot of different sites and conditions. Now, one word of warning, percussion massages and massage guns are widely marketed. Info in the description, but they work like jackhammers rather than sending therapeutic vibrations. They don't work as well and do a lot more damage. They're the last things you need if you've got fibromyalgia. Now I've linked a guide on how to choose a massager, or you can just get one of ours and it'll be good. Now, comments and questions are welcome. Thank you very much for watching. It has been most appreciated.